welcome back to another episode of Healthcare Igniters. And as you know, Healthcare Igniter is a series of conversation with thought leaders. And today's thought leader is Hemal Brahmbhatt. And he's an MD and a bioengineering degree on top of it. And then he has almost close to a decade of experience working in the industry on predominantly medical device manufacturing, working for GE Healthcare. Does field consulting for all the healthcare providers. And welcome, Hemal.
Hey, Siva. Thanks for having me. I really appreciate it.
Absolutely. With the breadth of expertise you have on medical as well as technology and broad experience working in the industry, the right topic to talk about today is education. And does the education needs to evolve?
Absolutely. I mean, look at the growth of technology around everybody, and then pick healthcare specifically, right? In a physician's life, wearables, day-to-day, there's technology everywhere. Then on a patient care, there's a whole different side. Now, if you break down healthcare and medicine, you'll see on imaging, you have better images. You have more efficient, reliable, targeted solutions with some type of ML. On the clinical side, you have the guided surgeries that people are doing miles away, like the Da Vinci started. Diagnostic medicine is getting more smart and reliant on different tests and quicker results. And then think about AI, ML, how that's even being put in to help grow this whole personalized medicine aspect, right? And then think about how many devices are around us that are collecting data constantly, and how much data can be manipulated to learn more about the patient when you're not there, right? I'm sure soon even cars will start, collecting. That's how close we've gotten. But if you look in preventative medicine, you'll see, Fitbits and wearable technology, your phone's collecting data on where you're walking, how much you're walking, how many steps you're taking. So with all this going on, do you think, to me, it blows my mind, how can we not implement technology within healthcare, right?
Yeah.
Technology is an integral pillar or a foundational pillar to help grow and improve healthcare. Yeah. And in that, HCPs, I'm not going to say physicians, clinicians, I'm going to make it broad, as HCP healthcare providers, it's very crucial for them to understand this technology and have that technology part of their education.
How much of the technology is in education today?
I think it's very little, right? So if you look at from when an HCP starts in school, there are tools that'll help them, right? You have apps that have mock patients or case studies to help outside of the hospital world for a medical student or an HCP to train. You'll have robotic patients that will help you understand and see telltale signs to help with your diagnostic or clinical medicine. Yeah. But there's no actual applied technology or dedicated time in the medical education time set where we're actually learning about technology. Yeah. At least I haven't seen it. And nothing in which will actually enable the clinician to have a better environment or to provide better healthcare quality or quality healthcare. Yeah. There's nothing like that that I've seen, at least.
It just kind of scares me. That, so much, I heard some statistics around every year, almost 5,000 new medical equipments are being invented and introduced into the field. Not having that much training, who would we believe, right? And so what is the risk you see?
Yeah, so that's a great question. So Siva, you just told me 5,000, right? Yeah. I would love to hear from a physician if they've even read 5 of those, right?
Yeah.
Honestly, because the way the system works on grueling, running around, just you're putting in so much information, so much less time. There's no time opportunity left to learn technology, right?
Yeah.
Their training years, they're learning, regurgitating knowledge, pushing forward. But when in their clinical nights, by pushing more and more patients through due to the hospital operations or personal operations, however they've set it up. Yeah. But we don't have time for that. Okay. So you asked me about the risk. I think it's very important because technology is going to get more and more integrated in individuals' lives, as well as getting complex. And if the HCP's knowledge doesn't match where we're going, there's going to be that gap, which is going to create a huge amount of problems, right?
Yeah.
I think, Siva, when you and I once talked, you told me about 40% of medical devices are vulnerable in the hospital today.
Yeah.
I didn't know that. How many physicians do you know that? And how many HCPs on a day-to-day basis are taking preventative medicine or preventative measures to make sure that patients in their day-to-day life, they're making sure PHI doesn't leak out, right?
Yeah.
They're not aware of the issue, let alone know a solution or quick resolving quick hits to help solve the issue, right? So it's a two-step problem. There needs to be technology like integrated, dedicated into healthcare providers' education model. And think about AI, right? Now AI is something we barely understand in any industry, right? And now it's going to be really integrated into healthcare. Look what Watson's doing, and we're manipulating data on a day-to-day basis to help deliver not only optimized workflow but personalized medicine. When does the physician get time to sit down and actually understand, or even take a breath, a step back for a moment and say, okay, this is what's going on, right? I had read an article once that said 25%, 1 in 4 surgeries, the errors that are caused by technology.
Wow.
Now let's think hospital standpoint, right? The most expensive operations in a hospital mindset is the OR, right? Operations portion. And if then 1 in 4 errors are due to technology, and then the people using that technology are not equipped, number one, to solve it, B, don't have the time dedication to learn about it, that's just bleeding money into healthcare.
So with all these risks, how do we solve for it? What us practitioners should do?
When we're talking about medical errors due to technology, I think there's 2 major issues that are there. One is device usability, basically. How can we make it easier for the user, UX, UI, and that goes more to the OEM or whoever's creating the technology, the owner of the technology. I think the biggest crucial thing that we can take in action is caregivers' knowledge, right? How do we create quick guides? How do we create dedicated time for technology being able to understand? Not a CME course that you take maybe once in 3 years, but a dedicated time. And if the HCPs are so busy, how do we create something of a platform, right? Where they can come together and learn quickly on online, mobile phone, whatever it is. I think that's what needs to happen in order to really, really help not only the physician understand, but that's going to lead to better patient care and more optimized entire efficiency in healthcare, which will hopefully bring the prices down too.
Absolutely. Totally agree. And it's both better education leads to a quality of care and also overall cost of care for everybody. And I think it's great insight we got from you, Hemal. Thank you for your time today.
No, thank you for having me. I really appreciate it.
Absolutely.